Dan untuk itu kerajaan memutuskan untuk melaksanakan Perintah Kawalan Pergerakan mulai 18 Mac 2020 iaitu lusa hingga 31 Mac 2020 di seluruh negara.
In this video, we will discuss about impact and challenges of COVID-19 in the listed hospital. Pantai Hospital Penang, Pantai Hospital Kuala Lumpur, and Pantai Hospital Air Keroh. This is the address and contact number of the listed hospitals. Next, we will go through the hospital background for the listed hospital. First, Pantai Hospital Penang. It is established in 1997, and this hospital has become preferred healthcare center for both locals and medical tourists. Second, Pantai Hospital Kuala Lumpur. It is established in 1974. And it is one of the pioneer private hospitals in Kelang Valley. This hospital has been accredited with Joint Commission International (JCI), Malaysian Society for Quality in Health (MSQH), and certified as a baby-friendly hospital. Third, Pantai Hospital Air Keroh. It is established in 1986. And this hospital has become the preferred choice for patients in Malaysia's southern region. All of the Pantai Hospital is committed to excellence in healthcare and patient experience. Thus, it strives to bring the patient the best medical care covering a wide and diverse range of specialized areas.
COVID-19 pandemic have brought a huge impact to the world, especially to the healthcare sector. Almost every day, there will be a number of COVID-19 cases being reported. As for 10th of August 2020, the total number of 9,094 confirmed cases has been reported in Malaysia. This has put a lot of pressure, especially to those who are working at hospital or any healthcare center. And all of these frontliners have been working 24/7. And they have been working very hard in order to break this chain of infections and to prevent the spread of COVID-19. In Pantai Premier Hospital, for example, Dr. Muhammad Azwan Abdul Razak, the Senior Resident Medical Officer of the Emergency Department at Pantai Premier Hospital, said that approximately 2,000 visitors, which include in and out patients, will come in a day, and thousands of tests will be conducted at the lab during this pandemic. This has put a lot of pressures to the workers and somehow affecting them physically and mentally. Pantai Premier Hospital does not only face the challenge of treating a enormous number of patients every day, but also affected with the current trend of viral message that claim that Pantai Premier Hospital is not a safe place to be visited, where there is a risk of getting infected there, as the fake news claim that one of the nurses was positive with COVID-19 after coming into contact with one of the Japanese patients who was being treated during that time. This was happened on March 2020, and fortunately, Pantai Premier Hospital has been very quick in responding to that news and has released a statement on their particular website stating that all medical workers who have been in contact with the nurse have been quarantined and all of them were tested negative. Similar to the other healthcare institutions, I believe Pantai Premier Hospital has been working very hard up until today, providing all of the necessary treatments and cares in order to fight against COVID-19.
Due to sudden COVID-19 pandemic, Pantai Hospitals and Pantai Premier Pathology take actions by becoming support for Malaysia frontliners in providing screening services to the public. Pantai Premier Pathology has been selected by the Ministry of Health along with the other 3 private hospitals to provide the COVID-19 sample from home services to the community. Besides that, as part of their commitment to serve better for the community, Pantai hospitals are also providing COVID-19 drive-through screening services. They are also on-site screening services that are available for individuals and companies at their own premise upon request. The screening test can be done with appointment only, and this map is the example of drive-through COVID-19 screening services in Pantai Hospital Icon. Pantai Hospital employs a technique called PCR. It has a higher sensitivity to detect COVID-19 and has an accuracy rate of 99%. The test result will be ready in 24 to 72 hours and it will be informed via call, email or courier to the shared address. If the test result is positive, the result will be sent to IMR for further evaluation and Pejabat Kesihatan Daerah will also be notified. The individual who involved is advised to proceed to the designated hospital for COVID-19. So, who is eligible for the COVID-19 drive-through screening services? All individuals without symptoms who wish to screen for COVID-19, individuals with symptoms but no history of traveling overseas, and lastly, individuals with symptoms but no history of contact with known case of COVID-19. There are conditions. The request for COVID-19 drive-through screening services will not be processed. Travel to or reside in a foreign country in the past 14 days, any close contact with confirmed COVID-19 case, attend event associated with known COVID-19 outbreak, and on home quarantine as advised by Pejabat Kesihatan Daerah. Lastly, for future planning on fighting COVID-19, they plan to involve this service to all Pantai Hospital branches and to ensure this service can be benefited to all communities across Malaysia.